In 2018, the South Dakota Department of Health and the CDC entered a 5-year plan to implement preventive cardiovascular programs. One of those programs is the Self-Measured Blood Pressure Monitoring Program that is overseen by Rachel Sehr.
Somebody is identified as having elevated blood pressure, and they are able to check their blood pressures at home on their own outside the clinical setting, usually a couple times a day for either a couple weeks to even months.
Josh Ohrtman, director of the Community Pharmacy Enhanced Services in South Dakota, says most of the patients in the program were recommended because of their high blood pressure.
And then the patient's trained on how to properly take their home blood pressure, how to use the machine properly, and then the pharmacist will follow up with that patient over the course of weeks to months, whatever it really takes to get that patient to their blood pressure goal.
Sehr says the program is very beneficial to many rural areas that don't have access to health care.
In our bigger cities, we have lots of access to healthcare, but that's only 2 areas really within the state. And so a lot of our residents can have to travel 30 or 60 minutes even to reach a primary care provider.
And it helps rural patients by limiting travel, but also makes sure they are staying healthy.
Having a program like this, where you only have to go to the clinic or to the pharmacy just that one time, and then you're able to do a lot of that follow-up at home, and then communicate back and forth either through phone or through your healthcare portal or things like that.
You know, with limited healthcare providers in the state and just the healthcare provider shortage that we have, you know, when our programs are getting patients to their blood pressure goal, that eliminates the repeated appointments, the follow-up appointments to go in and check. Subsequent visits are reduced.
Over 1,000 people enrolled, and both Sehr and Ohrtman say it was a success.
Without the ability to measure blood pressure to see on a consistent or, you know, a time frame, it's really difficult to know where a patient's blood pressure might be. But with consistent recording and trends and things, it's able to see if that medication is working or if it's not working.
And although the agreement ends this year, Sehr says they will try to keep the program around in South Dakota.
We're going to do everything we can to try to continue this programming and continue to offer assistance to our different healthcare providers and community organizations that want to enroll in and develop programs like this. So we are crossing our fingers that the next CDC funding allows us to continue that.